Hello and welcome to the 2024 in-service for Minnesota Home Care. We're just going to start with a few notes. First, if you have a new address, email, or phone number, please make sure you make a note of that somewhere for us. Also, if your client has a new address or phone number, please keep us updated on that. This is very important with the HHA exchange system that we have everybody up to date at all times. Please be sure that you're watching your email for the extra monthly trainings. This will be some videos, some reading. It's just some more in-depth training. So watch for that one time a month. And then everybody should be doing the electronic timesheets along with their paper timesheets unless EVV is not required for your client. There are some homemaking and respite clients that do not require it, but if we have asked you to sign up, then you need to do it. Make sure you're still doing your paper time cards. Make sure they are filled out correctly. If you need to use whiteout to fix it, then we're going to ask you to redo it. Same if you cross anything off on it. Just make sure we get a nice, clean, good copy for payroll. Make sure they are an original timesheet every time. They cannot be copies. The time in and time out should be filled in with AMs and PMs, and then your total time. Make sure you are initialing what you're helping with for the day, such as bathing, dressing, or grooming, and make sure signatures and dates are on there along with your PCA number. Make sure they are in the office on the Monday that they are due before 4 p.m. and correct. Also make sure that you are not working more than 40 hours per week for Minnesota Home Care, and that's Sunday to Saturday, unless you were approved to do overtime. All overtime must be approved by the office first. And then make sure, especially with HHA Exchange, that you are signing in and signing out for every single shift. That is very, very important. For the care plans, make sure you only do what is marked on the care plan. Make sure you are only marking on their timesheet what they are approved for their care plans. So for example, if they don't normally get help with toileting, but they're having a hard day and you help them on and off the commode, we still can't mark that on the timesheet. If the client has flex time and you use too many hours and they run out, you don't get more hours. You can always call us and see where they are at for their hours. Make sure if you haven't yet, you like our Facebook page for updates on job openings, and we do a lot of fun contests and stuff like that. It's the best place to go to keep updated with what we have going on. If you have a fever or any symptoms of COVID-19, please call the office right away so we can monitor the situation and get you covered if we need to. And then if you are sick and need to call in, make sure you notify the office at least 2 hours before your shift starts so we have time to find a replacement for you. And then make sure you're doing everything you can to prevent illness, sickness, all that. Make sure you're washing your hands good with soap and water. If you don't have soap and water, use sanitizer. We do have extra sanitizer here at the office. We also have a limited number of masks and gloves if you need them. Breaks while at work. After 4 hours of work, you may have a 10-minute break. Make sure you're wearing appropriate clothing. We always say no cleavage or butt cracks. Make sure you're covering up. We may ask you to wear scrubs if needed. We do have extra t-shirts here at the office if you need something to look presentable at work. Make sure you're using appropriate language at work, no swearing even if your clients do it. If your client is admitted to the hospital, make sure you let us know about it ASAP. You cannot claim any hours while they are in the hospital. The insurance company will catch it and it's fraud. That could equal fines or jail time. So we got to make sure that we aren't claiming any time while they're in the hospital. You can't do any pets or outside chores such as raking leaves, washing windows, shoveling snow, any of that stuff. Make sure you are remaining confidential about your client at all times. We may ask employees to do a drug test at any time. Make sure you're not bringing your kids to work, even if the client says it's okay. It is our company policy to not be bringing our kids to work. And then make sure you are not on your cell phones while you are working. Make sure you have it on silent. If you need to answer it, ask to step outside. Make sure your clients' walkways are clear and cleaned up. If they have animals, make sure their toys and food dishes are not in their walkways. And then make sure you are not touching people's med bottles at all. If they get them fingerprinted, you could be prosecuted, so we just don't want to be touching people's med bottles at all. If they already have their pills set up in a caddy or a cup, we can hand that to them, but we cannot be touching their pill bottles. We do have a health insurance reimbursement program for all employees that work at least 32 hours per week. That is where you find your own insurance or health insurance program, and then we reimburse you a certain amount based on your age. So if that's something you're interested in and you work at least 32 hours per week, make sure you let us know. We also have the health and disability plans for those that work 32 hours per week or more, along with dental and vision. If you have those plans, don't forget to use them. And then again, starting in October, you will be able to get paid to take care of spouses and also minor children. So let us know if you or anyone else has any questions regarding that. We'd be happy to help you out with that. And lastly, a very important piece of information that we have is every employee that works for Minnesota Home Care is eligible for a one-time payment of up to $1,000 that will be dispersed in early 2025. There will be a form added on with your in-service stuff here, and you must fill out the form and opt in to be eligible for that $1,000 payment. If you do not wish to share your personal information, such as your name, date of birth, social security number, with the state of Minnesota, you would have to still fill out the form but hit opt out, and then you would not be eligible for that $1,000 reimbursement. The reason they want your information is to make sure that if you work for more than one agency that you are still not getting more than $1,000. Chances are if you work for two agencies, you'll get $500 from one and $500 from the other, or if you work for four, you'd get $250 from each of them. That's just how they're double checking to make sure people are not getting $1,000 from each agency. If you have any questions on that, let us know. Otherwise, that Minnesota CareForce incentive pay form will be attached with the rest of your in-service stuff. So now on to the in-service packet. We're just going to go through the questions. If you have any questions after you go through the packet, call us, email us, stop by the office, whatever works for you. Number 1, employees must have a criminal background study with fingerprints prior to providing care is true. Each client will be given a copy of the of the Bill of Rights is true. Agencies must have a system to receive, investigate, and resolve any complaints received is true. If you report suspected maltreatment and it turns out to not be true, you will be prosecuted. That is false. Each client will have an up-to-date care plan in their book. That should be true. If they don't, let us know. Minnesota Home Care Bill of Rights quiz. Number 1, a person who receives home care services has the right to refuse services or treatments. That's true. If I go in to take care of somebody today and they don't want to get dressed and they want to stay in their pajamas all day, that is okay. Same if they don't want to shower, that's okay too. I would just document it on the back of their time card if it gets to be a regular thing. Number 2, a person who receives home care services has the right to complain about the services being provided to a person of their choosing is true. 3, a provider must never protect and promote the rights of the client is false. 4, a person who receives home care services has the right to any information in their file is true. 5, a person who receives home care services has the right to be treated with courtesy and respect is true. 6, a person who receives home care services has the right to receive care and service according to an up-to-date care plan is true. Fraud. The questions are on page 2. It is a felony to claim even 15 minutes that you did not work is true. Minnesota Home Care will not tolerate any fraudulent activity is true. Boundaries. Number 1. It is important to maintain a healthy relationship with your client is true. You should not talk about your personal life with your clients. It's true. You cannot exchange gifts with your clients. It's true. CPR. Number 1. If you are well trained to do chest compressions, do them at a rate of 100 to 120 beats per minute. Is true. Remember the acronym CAB, compressions, airway, breathing. That's true. Medication administration on page 3. Number 1. Medication should be set up by an RN or a family member. Is true. Direct support workers may pick up medication from the pharmacy with the client. Is true. You cannot do it without the client. Number 3, DSWs cannot draw up injectable medication. Is true. communicable disease. There is a short video with that one. If you would like to watch it, there is a list of videos towards the end of the packet that you should be able to just click on, and it should take you right to the videos. If it does not, you should be able to copy and paste the link into your browser and it will take you to the videos. Questions are on page 4. Number 1, washing your hands is not important if you are wearing gloves, is false. You should not go to work if you have a fever, is true. Number 3, the most important thing you can do to prevent communicable disease is wash your hands and use hand sanitizer often. It is good to stay current with your immunizations and flu shots, is true. Number 5, call the office right away if you are sick so we can get you covered, is true. Infection control, questions on page 5. Number 1, employees must wear gloves when expected contact with blood or body fluids, is true. 2, receiving a flu shot each year is not important, is false. PPE can include gowns, gloves, and masks, is true. The best way to protect yourself is to wash your hands often, is true. Infections can be transmitted by air, blood, or direct contact, is true. HIV is an example of a blood-borne pathogen, is true. Either bleach or Lysol is a good disinfectant, is true. Hand washing, number 1, wash your hands and wrists with warm water and soap, is true. 2, you should wash your hands for at least 15 seconds, is true. 3, you should turn off the faucet with a clean, dry paper towel, is true. TB, number 1, TB usually affects the lungs or other organs, is true. Chest x-ray can be used to test for TB, is true. TB is treatable with 3 strong antibiotics for at least 6 months, is true. On to page 4, caring with clients with HIV or AIDS. Number 1, good hand hygiene is important when caring for clients with HIV, is true. You may need to wear gloves, gown, mask, and face shield when caring for your client, is true. Preventing transmission of infectious agents is important, is true. Teeth, gums, and oral prosthetic devices. Number 1, irregular oral hygiene is very important, is true. If the client is experiencing any mouth discomfort, they should contact their dentist right away. That is true. On bed rails, number 1, on page 7, it is important to understand the zones of entrapment if your client has bed rails. That's true. Number 2, DSWs may only operate bed rails after they have been properly trained, and that is true. Transfer belt, number 1, apply the transfer belt over clothing and buckle in the front, is true. You should use an underhand grasp for a better grip, and that is true. Check female clients to be sure their breasts are not under the belt, and that is true. Page 8, temperature, pulse, and respirations. For that is the policy in Minnesota Home Care that direct support workers do not check or document temperature, pulse, and respirations of their clients. With that being said, it is okay to check and see if they have a fever to determine whether they are going to need to go into the clinic or something if they're not feeling well. We just can't document it or use it for charting purposes. Number 1, Minnesota Home Care direct support workers may not check temperature, pulse, or respirations for charting purposes, and that is true. Temperature measurement with an electronic thermometer. Number 1, be sure the equipment is in proper working order, is true. 2, the thermometer will beep or show a readout when it is complete, and that's true. Pulse and respirations. Have the client place their arm flat on a surface and relax their hand, is true. Count the pulse for 1 full minute, is true. 3, place 2 or 3 fingers on the palm and thumb side of the client's wrist, is true. And we got blood pressure. Questions are on page 9. Number 1, place blood pressure cuff snugly on their upper arm, is true. Inflate the cuff and then release air to check the blood pressure, is true. Weight measurement, make sure the scale is balanced or set to 0, is true. Be sure to position the client on the scale correctly, is true. Height measurement, clients should have their feet flat on the floor when taking their height, is true. The measuring rod should rest horizontally on the client's head, is true. Height measurement when the client's unable to stand. Number 1, assist the client to lie flat on their back with their legs straight, is true. And then mark the sheet at the top of their head and at their heel with a pencil and measure, is true. Fingernail care, questions on page 10. Number 1, always ask the client if the water temperature is comfortable, is true. Always be careful not to cut the client's skin when clipping their nails, is true. Always wear gloves when assisting the client, is true. Foot care, number 1, apply soap and wash the entire foot, including between the toes, is true. If the client is diabetic, we cannot do nail care, and that is true. Partial bath, number 1, always ask the client if the water temp is comfortable, is true. Ask and assist the client to participate in washing if they are able, is true. You should wash and rinse all parts of the body, is true. Tub or shower bath. Encourage the client to assist as much as possible, is true. If the client becomes weak, get them into a sitting position, that's true. Assist the client with washing and rinsing their entire body, is true. Keep bed bath on page 11. Keep the client covered with a bath blanket, is true. Wear gloves while assisting, is true. Always maintain personal privacy and warmth, is true. Always work from clean to dirty, is true. Perineal care in a female, number 1, in perineal washing, go front to back, is true. Observe the client for any skin irritation, is true. For a male, wash the area front to back, is true. 2, be sure to wear gloves while assisting the client, is true. On page 12, dressing the client, number 1, assist the client to remove any soiled clothing, is true. And put clothing on their affected side first, is true. For range of motion, number 1, DSWs need to be trained to provide passive range of motion with clients, is true. Number 2, always check the care plan before you perform range of motion with your clients, is true. Transfer techniques on page 13. Number 1, how do you know what transfer technique to use for a client? Always consult the care plan. Number 2, always explain to the client what you're going to do before you begin the transfer, is true. Number 3, the client should always be asked to help with the transfer, and that is true. Walking with a walker, number 1, observe the client for dizziness before you start walking, is true. Walk beside the client holding the transfer belt with that underhand grasp, and that's true. Wheelchair transfer, number 1, be sure the client's stronger side is closest to the wheelchair, is true. Always check the client for dizziness and weakness before the transfer, is true. Check the client for comfort once they are seated, and that is true. Page 14, fall risk prevention, number 1, mobility issues can lead to falls, is true. Keep walkways free and clear from clutter, is true. Always be sure all precautions are taken to avoid falls, is true. Mechanical lift, number 1, you should be properly trained before using a lift, is true. No employee under 18 is allowed to use a lift, is true. Leave the sling in place under the client when the transfer is complete, and that is true. Sideline position placement, number 1, the bed needs to be locked, is true. All joints should be supported, is true. And then number 3 on page 15, always check for proper body alignment, is true. Supine position placement, number 1, always check the client for pressure areas, is true. Place the client on their back with their arms at their side, is true. Positioning, number 1, elbows and knees are often an area of skin breakdown, is true. Pillows are a great way to aid for repositioning, is true. A reddened area on the client is often the first sign of skin breakdown, is true. Clients must be repositioned at least every 2 hours or according to their care plan, is true. A reddened area on the body must be reported to the client or their representative, and that is true. Moving up in bed, number 1, ask the client if they are able to bend their knees, is true. Slide your hand or arm under their upper back and shoulder and your other arm under their hip and buttocks to move them, is true. Number 3, instruct the client to push with their hands or feet on the count of 3, and that is true. On page 16, moving up in bed using a lift sheet, number 1, ask the client to assist if they are able, is true. One hand should be at the client's shoulder level and one at the hip level, is true. Lift with the sheet rolled to the client with the underhand grasp to hold the sheet, is true. Occupied bed making, number 1, you need to wear gloves if the linen is soiled, is true. Keep the client comfortable while making the bed, is true. Nutrition, number 1, direct support worker staff should encourage well-balanced meals for the client, is true. Breakfast is a very important meal, is true. Some clients may have a special diet they need to follow, and that is true, and that should be in their care plan. Clients need plenty of fluids each day, such as 6 to 8 glasses of water, and that is true. And if they don't like water, whatever they like to drink, just make sure they have some by them so they're getting plenty of fluids. Feeding a client, number 1, sit the client up at least 45 to 90 degrees, is true. Encourage the client to self-feed if they are able, is true. Always check to make sure the client's mouth is empty before feeding more, is true. Offer the client sips of water throughout the meal if they can have it, is true. Heimlich maneuver at the bottom of page 17, number 1, if a person is choking, assess the situation and begin Heimlich if needed, is true. On page 18, number 2, have a bystander call 911 if possible, is true. If the person is coughing, you can stop the Heimlich maneuver, and that is true. Bathroom and commode assistance, number 1, ensure privacy but do not leave the client alone if they are unsteady, is true. Use gloves to assist to wipe, is true. Assist the client to wash their hands when they are done, is true. Empty the urine drainage bag, number 1. You should always wear gloves, is true. 2, measure the urine and empty the graduate, is true. 3, be sure to rinse the graduate with cold water, and that is true. Dealing with Alzheimer's and dementia, questions are on page 19, number 1. There are 3 stages of Alzheimer's, is true. In late stages, they may need help with all daily tasks such as eating, which is true. If the client's behavior can be redirected, do so, which is true. Number 1 at the bottom of page 19, always respect the client's personal space, is true. Minnesota Home Care does not allow the use of manual restraints, is true. Number 3, follow individualized strategies in the client's plan to help them calm down, and that is true. Number 4 at the top of page 20, call 911 if there is a risk for injury to the client or anyone else, is true. Speak to the client in short and simple sentences, is true. Behavior intervention, number 1, call 911 if the client's behavior is unsafe, is true. Consistent redirection is usually effective, is true. Verbal and visual cues are often more effective than just verbal cues, is true. If the DSW is having trouble handling behaviors, they should be terminated, is false. Safety is very important with behavior issues, is true. Hearing loss on page 21, number 1, there are 3 types of hearing loss, is true. Hearing aids may be a good option for someone who has moderate hearing loss, is true. Hearing loss can affect speech and learning, is true. Care plans, number 1, the care plan directs all cares, is true. Number 2, the service agreement and care plan will always match, is true. Number 3, the care plan quiz must be completed by the worker and return to Minnesota Home Care, is true. Care plan can be found in each client's book, is true. If not, let us know. We'll get you an updated copy. Number 5, care plans may need to be updated if there's a change in condition, and that is true. Number 6, the supervisor and participant's representative make sure the direct support worker is following the care plan, and that is true. Direct support worker responsibilities, number 1, education needed to be employed by Minnesota Home Care is required every year, is true. Direct support worker schedules are determined based on what the direct support worker wants to work. That's false. It should be what the client needs for a schedule. Number 3, DSWs must read and understand the care plan and provide cares according to the care plan, is true. Clients or their representative must verify all hours worked, is true. Direct support worker may add hours to their time card they did not work for gas money, it's false. DSWs can take a 10-minute break after 4 hours of work, is true. DSWs should sit on their phone and text and call people while they're being paid to work, obviously false. Emergency preparedness, number 1, each client must have a backup person in place in case of an emergency, is true. It's usually a neighbor, friend, family member, something like that. Number 2, there are ways to be prepared for emergencies such as having extra food on hand, is true. A communicable disease outbreak such as COVID-19 can be an emergency, is true. Handling emergencies and using emergency services, number 1, call 911 if you have an emergency, is true. Number 2, stay on the phone until the operator hangs up, is true. Number 3, notify Minnesota Home Care if an emergency occurs, is true. fire prevention. Questions are on page 23. Number 1, always make sure that your escape routes are clear, is true. Report any fire hazards you see, is true. If there is a fire, assist the client out of the building to a safe location, is true. Handling home care complaints. Number 1, there's a home care complaint form in each client's book, is true. Number 2, you can always call Minnesota Home Care with any concerns at any time, that is true. Child passenger restraint system. This is a new section that we have this year. If you have a client that you take care of that is under the age of 8 years old and is still in a booster seat or restraint seat of some sort, please let us know so that we can make sure that you get the proper training. So number 1, a child under the age of 8 years old should be in a safety seat, is true. All children under the age of 13 should be in the back seat, is true. When using a rear-facing seat, you need to make sure that the base of the seat is level, and that is true. Cultural communications training. The quiz is over on page 27 for that. Number 1, federal financial assistance may not restrict service or aid based on race, color, or national origin, is true. Our own beliefs should never affect how we provide cares to others, is true. Each person's cultural identity is unique, is true. Effective communication is necessary to be culturally competent, and that is true. Vulnerable adult training. The questions for that are on page 29. Number 1, all employees of Minnesota Home Care are mandated reporters, is true. VA reports can be made to Mark 24/7, 365, is true. Involuntary seclusion is considered abuse, is true. Maltreatment means abuse, neglect, or financial exploitation, and that's true. The person receiving PCA CFSS services is a vulnerable adult, and that is true. Positive support strategies and person-centered planning are over the next couple of pages. The quiz for those are on page 32, and that number 1 is sit down with your client and talk about what is important to them, and that's true. Every client will have different goals, is true. Supporting your client's social and emotional well-being is important, is true. Stress can cause headaches, anxiety, and tension, that's true. A certain task may be easy for you but hard for somebody else, is true. For some, simply taking a bath can reduce stress, is true. Nutrition goals can be a good conversation starter, is true. Number 8, find out if there's a specific schedule or routine that your client would like to stick to, and that is true. And then under that is that list of all of the videos. If there are any extra ones you want to watch there to get a little bit more in-depth training, feel free to do that. On page 33, the last page of the packet, I'm just going to read through the concerns and acknowledgement. Make sure you know it's your responsibility to notify Minnesota Home Care immediately of any problems or concerns relating to the care and circumstances of the client you're caring for, especially if they're hospitalized, they have a change in address or phone number, or if they move. You know it's your responsibility to notify Minnesota Home Care immediately in writing of any employment changes such as termination. Make sure we have time to get your client covered before you resign. And you acknowledge that it's the policy of Minnesota Home Care to do random drug testing, which may be a urinalysis and or hair follicle. Make sure you have read and understand the Bill of Rights and the home care complaint form that's in your client's book and understand how to contact the Ombudsman's office. You know you cannot work more than 40 hours in a week with Minnesota Home Care Sunday to Saturday and 275 hours per month as a direct support worker, no matter how many agencies you're employed with or how many clients you care for. You know you can only care for one client at a time unless shared care is offered for your client. And overlapping hours is against the law unless approved by the state of Minnesota as shared care. If you are found guilty of committing fraud, your employment with Minnesota Home Care will be terminated and you will not be eligible for rehire. Also, will be responsible to repay any wages that were paid out that were found to be fraudulent and any fees that occur because of the fraud. Make sure you notify Minnesota Home Care if your client or yourself is sick, have a fever, or any symptoms of COVID-19. You understand that if your client requires EVV and you're not properly clocking in and clocking out, and if the time card is not in the office on the Monday that it's due by 4 p.m. unless otherwise approved by Minnesota Home Care, you may not get paid for that time card until it is correct. Understand you must never borrow money from your client or to your client. It can lead to termination. And then you understand it's your duty as an employee of Minnesota Home Care to remain confidential about any information that has to do with your clients as outlined in the HIPAA rules and regulations. And then make sure you sign and date the bottom of this form. If you're doing it online, make sure you click the little checkbox that says you understand that you're e-signing this form, and then type your name and date into that. So that is the in-service packet. You also will have a monthly training record, fraud, waste, and abuse form, a TB form, a hand washing form, drug and alcohol policy, earn sick and safe time policy, transportation policy, that Minnesota Care Force incentive pay form that we talked about. If you are full-time, you will have a health insurance reimbursement plan form that you can either accept and get insurance or decline. Make sure you fill out the form either way, and if you're going to decline it, put your reason for the decline in there. And then you will also have a payroll schedule for next year. If you have any questions for us, please give us a call here at the office at 218-963-8899 or shoot us an email at tgetty@brainerd.net. Thank you for coming to the 2024 in-service, and we hope to see you soon.